President Cyril Ramaphosa yesterday announced that the country will be moving to a level 4 lockdown with stricter restrictions from today, with Gauteng accounting for over 60% of new infections. Travel in and out of the province for leisure purposes is prohibited. Now let's discuss this further. We are now joined via Skype by Tshifhiwa Tshivhengwa, Chief Executive Officer at the Tourism Business Council of South Africa. A very good afternoon to you, sir. Thank you so much for your time. Now, earlier I was listening to an interview by the Restaurants Association, and they were saying that basically the announcement by the president last night was a little bit irresponsible, both from, saving lives, but more especially, as it spoke to the economy and the livelihood of the country. What's your reaction?
Well, what we have seen so far is that many people that have booked their trips, those that are from Gauteng that were supposed to go to places like Limpopo, Northwest, Cape Town, Durban, and many places around the world, around the country, have started to cancel their trips. We have seen this now with the Sun International Group closing, their hotels and casinos because of these restrictions that have been announced last night. So for us, it's devastating. The industry, had hardly recovered. We are now in a situation whereby those employees that were back at work for a few days or coming back to work for over the weekend, they now have to stay home for the next 2 weeks and without any income and without any hope. So it is important that, we stress that, the industry has suffered. It's still continuing to suffer. Our recovery is going to be longer, and this is another dent on the recovery, and it's going to take us even longer to get the domestic market, to come back to where it was.
Now let's zone in on Gauteng, because we know that that is the province that is hardest hit with the third wave. What impact will the travel restrictions imposed in Gauteng have on the sector specifically? I mean, I know that other provinces are not so much affected, but essentially somebody that is going to be traveling, say, for instance, from the Western Cape or even the Northern Cape to Limpopo, as an example, will have to pass through Gauteng. What are we saying in terms of just, how people will firstly be able to do that practically, but also the effects that it will have on Gauteng as a province specifically?
Well, 60% of domestic travelers in South Africa come from Gauteng. They either fly, they either drive themselves or rent a car or use other mode of transport. So when we say that people in Gauteng should not travel, the effects of Gauteng people not traveling will be felt across the entire country. When it comes to those that are traveling from other provinces passing through Gauteng, let's say someone from Free State or Northwest going to Mpumalanga or going to Limpopo, they have to pass through Gauteng. We need to have a mechanism that makes sure that they can pass through in a safe way, because they are in transit. They are not coming directly into Gauteng. If you look at the regulations that have been put out, they don't have a mechanism for police to say person A who's traveling from Free State to Limpopo is not traveling from Free State to Limpopo, or a proof to say that you're just passing through. We don't have that mechanism. So the situation at hand is that if you're traveling from one province to another passing through Gauteng, we don't know what you need to have to show that you're passing through Gauteng. So that's a difficulty, and we need a remedy for that situation. But in terms of the entire country, everyone is going to suffer if Gauteng is not going to be traveling. The places like Limpopo, the feeder is Gauteng for Limpopo, the feeder is Gauteng for the Northwest Province. If you look at the Sun City, you look at the Pilanesberg, you look at Kruger National Park, you look at the Free State, the Drakensberg, Gauteng is the feeder of those tourist destinations. The fact that we here in Gauteng are not able to travel, it means that everyone else across the country is going to feel the effects. They're not going to be able to go to work, and they're not going to be able to put food on the table.
At the onset of the beta variant, which is the variant that was originally found in South Africa, we saw a lot of countries, international countries, imposing a travel ban to South Africa, following that variant. Now we have traces of the Delta variant in about 5 provinces in the country, and this is information obviously that is coming out recently. Are we likely to see more travel bans being imposed in the country now that we've got two very powerful, as it seems, variants that are currently ravaging the country?
Well, the countries that have put travel bans, they look at the Beta variant and they thought that it was more dangerous and they didn't want it in their own countries. Now we have the Delta variant, of which many countries that we do tourism with already have the Delta variant. So what's most likely going to happen is that now they're going to forget about the Beta variant. And if Delta became the dominant variant in South Africa, they're going to focus on that. And if we have the matching variants between ourselves and, let's say, the UK, it makes no sense for the UK to keep, their citizens closed up and to say that, you can't go to South Africa because they've got a variant. It may actually become a little bit easier for them to say, well, we already have the matching variant. We already know the efficacy of the vaccines, and therefore traveling between the countries can be allowed. I think we must re-emphasize that, we're going to have many, many variants. And globally, we need to be able to allow people to travel, and we need to coordinate ourselves better. We can't have a situation where there's a variant that comes from one country and then we ban people from traveling there. These variants are going to be there. They're going to go around the world. We just need to travel responsibly. And it's something that we've been doing for many, many months. We've put protocols in place. The entire global travel industry have put protocols in place. And we should be able to travel safely. We need to address the issues of, restricting people from the source. We need to look at what is the source. Is traveling the source? And is the hospitality industry the source? And where are the problems and how do we deal with those? If we just impose blanket restriction, be it international, be it domestic, it doesn't help anyone. It doesn't help the industry. It doesn't help our recovery at all.
Well, if you're going to be asking the question of where is the source, I mean, the criticism has come directly at government's feet to say that the vaccination or the slow rollout of that program is probably the source. What's your reaction on how government has handled the vaccination process in this country?
Well, we all know that vaccination process have been slow, and we need to be frank about that. It has been slow. We are behind. And we should have been further along in terms of vaccinating the population. Now, if we want answers to our economic problems, we need to vaccinate. If we don't vaccinate, we're going to have another wave, and another wave. And that is not desirable because a lot of people are sitting at home, young people who have graduated and able to work because we cannot get this economy to restart. So vaccination is the answer. And we've got to do it fast, and we've got to make sure that we get enough doses to ensure that we vaccinate in mass. We can't have this situation of, trickling in to say, well, we're going to do X number today, X number tomorrow. We have said that, we can vaccinate as many as 200,000 people a day. We need to push those numbers, and we need to do that fast. If we don't vaccinate, we're going to be having the same conversation that we're having today in the next 4 months. And it's not something that the economy likes to hear. So for us, it has been slow. We need to get vaccination rollout on track. We need more vaccines, and we need to do it faster so that we can recover and we can get people back at work.
Tshifhiwa Tshivhengwa, Tourism Business Council of South Africa CEO, thank you so much for your time this afternoon. Really appreciate it.
Thank you.
Well, the IEC CEO